Misdiagnosis is one problem. Additionally, misclassification of severity is another problem, and both of which have important consequences.
This is Crisis Point. Imagine a medical education system where every aspiring dermatologist is trained to recognize and treat conditions across all skin types. A system where students learn the unique presentations of diseases in various ethnicities, the cultural nuances that affect patient care, and the historical biases that have long skewed medical research and treatment. Historically, dermatology, like many other medical fields, has been predominantly centered around certain demographics. But after many calls for highlighting diverse skin types in dermatology education that have occurred for years now, where are we today? In this feature, we will hear from 3 leaders in dermatology, all of whom help to illuminate the challenges and triumphs of integrating diversity into dermatology education and practice.
But I think it's important to just note that diversity can entail even beyond visually what you're looking at in the skin, where someone is from, where they grow up, socioeconomic status, the overall environmental exposome that somebody faces in their life, the entire sociopolitical structure around them. Race and ethnicity are one of several concepts in this larger structure we think about various social and structural determinants of health, in addition to intrinsic biologic factors as well. So it's important to note that probably, compared to maybe even a few years ago, we begin thinking about diversity involving all of these features and not maybe just the very limited epidemiologic categories that we've historically focused on. From a pure visual standpoint in dermatology, no two individuals have exactly the same skin, whether we're thinking about actual tone, biologic properties, response to the environment, or even visual representation of what a particular disease might look like. There can be a lot of heterogeneity. And one of the challenges we have in dermatology is really trying to parse through a lot of different people in a day-to-day clinical setting and really trying to figure out if what we're seeing is in fact the same disease process as X or a distinct disease process. And in many diseases, we know that in addition to differences in, number one, what the skin disease looks like, there can be differences in the overall representation of severity. Historically, the one factor we focused on as it relates to skin tone is redness or erythema, but there's others out there, but there could be different distributions, different areas of extent, different specific regional areas of involvement. And so diversity in the images we use to help study, train, and diagnose is really an important thing to talk about.
I trained in New York City. I was very fortunate to see a tremendous amount of skin of color. And I felt very, very comfortable when I graduated residency. But as I've gotten out into the real world and, so to speak, outside of residency and chatted with my colleagues all over the country and gone to different academic programs and given grand rounds talks, I realized that that's not the case. Some certain areas around the country just have a less diverse mix in the population or in that region of the center. And consequently, residents can graduate from a program seeing actually very limited diversity in terms of the patient population. And so as a result, they may be very well qualified to assess and manage the skin of the types of patients that they saw during residency, but that may miss whole swaths of the population.
So there is a growing recognition of the lack of inclusion of the broad range of skin types and populations that we see in the real world. We see a lack of representation of that in many of the educational resources that we have available. I will add, though, that there have been remarkable improvements in this regard over the past few years, that we are seeing more and more inclusion of a diverse range of skin types and populations in our materials, but we still have a ways to go until we see our educational materials truly reflect the real world population.
The real question that many people may be wondering when they think about this as an issue that affects everyone is, what is the actual danger, and what are the harms that can come from a lack of diversity within education in the field of dermatology?
If somebody wasn't really thinking about the broad diversity of, let's say, manifestation of a particular skin disease, misdiagnosis is one problem. Additionally, misclassification of severity is another problem, and both of which have important consequences. So, if you're not able to diagnose the disease correctly, then your treatment options may not necessarily be the best ones for a patient. If you are able to diagnose the disease, but you're not able to really categorize its severity, then you're probably going to be undertreating your patients and not necessarily giving them the best chance of improvement of their signs, symptoms, and quality of life.
But I had a young woman come to me and in tears because not only was she incredibly itchy and uncomfortable and just not sleeping, not functioning, but she was very demoralized because she had seen 3 previous dermatologists, the last 2 of which told her she had psychogenic itch, that essentially she was crazy and that the itch was in her head. And she needed to see a shrink to fix the problem. Now I had her gown up, I looked at the skin, and I was tongue-tied when I was speaking to her because I was standing behind her. I still remember in my head this encounter. And while she's fully gowned, and I'm thinking, what do I say to her? Not only was she not crazy, she was erythrodermic. She was covered head to toe, but she was a phototype 5/6, and she had more of this follicular eczema pattern, which is a distinct morphologic pattern that, it can happen in all skin types, but it's particularly relevant in patients of African descent, or in studies have shown also in patients of Southeast Asian descent. And so the previous dermatologists were just not adept at assessing, inflammatory skin disease and skin of color, and they just totally missed it. They thought it was dry skin, and they thought she was just crazy and she needed to see a psychiatrist.
Trainees and even practicing physicians, including dermatologists themselves, depend on visual representation of skin disorders in their education about them. And if there are gaps in representation of common skin disorders, this can lead to disparities in one's comfort level and knowledge level of being able to detect subtle differences that may occur across different patient populations.
We think about the potential missed calls around skin cancer. You had alluded to that earlier in the question. Sure, that's an enormous problem. But in the realm of inflammatory skin disease, underappreciating the severity of disease because it's harder to assess erythema, misdiagnoses, unnecessary biopsies, delays to diagnosis, exclusion from clinical trials from underappreciation of severity, perhaps not stepping up appropriately to advanced therapies in different diseases because underappreciation of the disease. So there's a lot of bad things that could happen, but fundamentally, I think these are mostly things that can be addressed from an education perspective. There's a lot we can do within dermatology, and we may not be able to fix all of the systems-based issues that are happening in U.S. healthcare, but within our wheelhouse, we can definitely work on the education and get dermatologists to recognize, morphologically those types of things and not miss that in the future.
So now the question remains, what's being done about this problem? And what will have to be done in the future?
The importance of inclusion of a diverse range and representative range of images it is so important, because if there is limited representation of particular populations or particular skin types, then the utility of the algorithms that are used to allow AI to be helpful to the clinician will have important limitations. And so it's critical that we ensure that the images used to develop the algorithms for AI tools are adequately representative.
AI comes with its own biases, and studies have shown that AI algorithms train differently around darker skin tones when looking at image analysis. So we're at the beginning, but certainly I welcome bringing to bear any technological advancements in this area. I think it's just a lot of fundamental clinical and regulatory science that needs to be addressed. The FDA has only recently started to build, or request diversity plans when developing clinical trials. So they're now aware of the problem and they're paying attention to it. But there are certain things like in dermatology, just at a fundamental level, are challenging to address in general, right, across all patient subtypes. But even taking photography, getting good images, it's really hard to get high quality, reliable photography for some of our skin disorders. And so it might be easy to do for pigmented lesions. It's really hard for some of our inflammatory skin disease. And that's true for all patients. Now, add to that the challenges of assessing erythema or certain morphologic characteristics in darker skin tones just makes it even harder. So we can't really apply AI until we get to some of the fundamentals of, are we taking high quality photos to train the AI?
Yeah, we've seen slow and steady progress over the past few years, and I think that it's really started with individuals trying to address what some of the shortcomings are in our core educational materials, and then trying to figure out how we can best add to these, both in terms of existing resources and creation of new resources as well. So there's been a big push for just a bigger cadre of representative images. A lot of our teachings are based in textbooks that have some images, also have words and tables as well, but I think there's been a big push for making those heavily slanted on images and in particular increasing that diversity. We've also seen a lot more photographic atlases come up too, where individuals have tried to just create entire compendiums of images and show you exactly how any one particular condition can look different from individual to individual. Finally, we're seeing a big push for educational efforts on the podium for individuals not only really using case-based or image-based learning, but also really ensuring that we have a number of different images side by side to get everybody on the same page when thinking about what a disease may potentially look like.
Throughout the didactics, probably in every residency program around the country, at the national level, at the AAD conference and others, regional meetings, etc., I think we've already largely fixed the problems because the conversation is happening. The lectures are happening. The diversity and attention to diversity is already being presented now at the conferences. Now, there's always room for improvement. Don't get me wrong. I wouldn't say let's settle on where we're at right now, but I think quite fortunately, major strides have already been made.
There is a growing recognition of the lack of inclusion of the broad range of skin types and populations that we see in the real world. We see a lack of representation of that in many of the educational resources that we have available.
The good news is that much progress was already sort of en route, if you will, maybe not right there, but en route once this more vocal conversation started to happen. And so we're actually seeing some major strides made. Some of that was because it was already happening, but fortunately it's come to realization, which is great. We've already seen major improvements in our conventional texts and online resources, etc., addressing diversity. And I think major strides have already been made and have already been addressed in largely. We've seen whole new textbooks and atlases developed specifically for the purpose of addressing diversity of presentation of skin disease. So that's been a major, addition to our toolbox for education. And I think, the residency, diversity of patient mix is something that has now become, I think, a much more important more recognized topic to be addressed, and is slowly but surely being addressed across residency programs. Now, that's a little bit of a harder issue to fix. Getting better photos in a textbook, pretty easy. Changing up your practice mix and making, getting residents to be able to travel to different areas to make sure they're getting appropriate diversity, a little harder to pull off, but it's happening.
I think that even in the expectations before you're invited to give a presentation or asked to give a presentation, you now see a lot more meaningful wording and expectation behind increasing the diversity of what you display. And I think that, while some may feel it's forced, in another sense, it really shouldn't have to be forced, and it should be ingrained in the way we go about our materials. And maybe it just wasn't necessarily taught to us in that way. So I think the fact that you're now seeing individuals trying to do side-by-side analysis of darker and lighter skin tones, trying to have a entire slide that can show for X disease, remember to think about all these different signs in addition to the classical one, which is the way that it was taught in our textbooks, which may not be broadly representative. That's very powerful. And I think that trickles down to people that are going to then go back to their institutions, their practices, their regions, and incorporate those same teachings too. So I've definitely seen a big change over the past few years, and I think that we'll continue to expect as such over the next few.
So the good news is that there are a number of efforts from various organizations and individuals in dermatology that have already helped close the gap in terms of representation of images across diverse patient populations. This would include textbooks. There are multiple textbooks that have already been published, and the number continues to increase, that focus specifically on dermatologic disorders in patients with skin of color. Then our mainstream textbooks that are designed to be comprehensive and cover the entire spectrum of populations in the world. More and more, they are including a broader range of images for common and less common dermatologic disorders. Third, we're seeing more and more content at continuing medical education meetings, CME meetings, that ensure that images shown and studies that are presented are more and more reflective of the diverse patient populations that we have in the real world. So we're seeing more inclusion within the CME space. We even have CME meetings that are targeted to provide education on areas that have historically been underserved, such as meetings that focus purely on skin of color or on pigmentary disorders. So they're highly specific CME meetings now that people can go to. Then there are visual databases of images, and there are a number commercially available tools. I won't mention the names, but that are widely available. And then organizations such as the Skin of Color Society, the American Academy of Dermatology, the National Medical Association, and others have resources that you can find on their websites that help to provide educational content for skin of color. So it's quite a robust list of options out there.
This has been HCP Live Crisis Point. Thank you for watching.